So I'm going to introduce our first speaker, which is Dr. Digby Cullen from Australian Doctors for Africa. Dr. Digby Cullen trained as a gastroenterologist in Perth, Western Australia. In 1992, he worked as a senior lecturer in the Department of Medicine at the University of Western Australia and went on to become a research fellow at Nottingham University. He was a consultant gastroenterologist. Oh my gosh, sorry, it's late in the afternoon. I need a coffee. At Royal Perth Hospital and at Fremantle Hospital as well. He has predominantly been in the private practice at St John of God, Subiaco. So please welcome Dr. Digby. Thank you.
Thanks very much, and thanks very much to Bill Rapard for giving our organisation the opportunity to present. The conference is a great idea, and it provides a practical way of joining Africa and Australia. Now, an Australian diplomat who returned from Afghanistan last year was asked whether he'd had an interesting time, and he replied, it was a little bit more nuanced than that. Aid work and I guess mining in Africa is a fairly nuanced business. Australian Doctors for Africa was founded in 2005 by Mr. Graham Ford, who's an orthopaedic surgeon, and provides a link between Australian philanthropy and African medical need. We work in 5 countries, Ethiopia, Madagascar, Somaliland, the Comores and South Sudan. The organisation essentially equips and trains thanks very much. We equip and train and do a little bit of infrastructure. We provide medical training and assistance, infrastructure projects, medical equipment and supplies, and some advanced development, particularly club foot programs and some scholarships. Our volunteers are medical teams. They're all medical and nursing and other paramedical volunteers, and they donate their time, and we get a lot of donated equipment from Perth hospital system, and we recycle this good but second-hand medical equipment into these countries. We have programs in orthopaedic surgery, club foot, gastroenterology, bronchoscopy, urology, paediatrics, obstetrics and gynecology, and ENT surgery. In Ethiopia, we've been particularly successful in doing orthopaedic training. We've had trained more than 100 orthopaedic surgeons and more than 200 nurses and technicians. It sounds a lot of orthopaedic surgeons, but when you look at a population in Ethiopia of 106 million people, you probably need about 8,000 orthopaedic surgeons to provide a good service. In Somaliland, we've had 3 orthopaedic surgeons qualified since 1991. We've qualified 4 doctors, and we have 18 surgeons in training. In South Sudan, we've trained 3 orthopaedic surgeons. In Madagascar, where we have quite a big program, it's a bit of a forgotten country, we've set up 6 endoscopy units in 4 cities and trained 15 gastroenterologists and 25 nurses to service these. There's also been quite good programs in urology, ENT, gynecology, and urological surgery, as well as orthopaedics. Orthopaedics is the constant thing that we've done a lot of, thanks to our founder, Graham Ford. Since 2001, ADFA has completed 6 renovations or new hospitals in Ethiopia, 6 in Madagascar and 5 in Somaliland. We've sent about 62 containers of donated equipment to Ethiopia, Somaliland and Ethiopia and Madagascar. The annual value of this donated equipment is about 500,000 to 1.1 million per year. Now, we're really fortunate we've managed to get a system where we recycle medical equipment from the West Australian health system to these places, and we've got quite a nice supply thing. All the old beds, all the old endoscopy equipment, urology equipment, surgical laparoscopy equipment, bronchoscopy equipment, all that sort of stuff, and beds and endless monitoring equipment, anaesthetic machines, all that sort of stuff. We get donated and we put it on a ship and send it over there, and then we have our volunteers who go and help set up training schemes for it. Clubfoot has been a real long-term commitment from Australian Docs for Africa, and the early detection and treatment of this really does make a big difference. If you're left with a clubfoot and walking on the side of your foot, it's a terrible thing. In Madagascar, we have 3 clubfoot clinics and treat about 150 people a year. I'd like to take the opportunity to thank Base Resources for ongoing long-term financial support for that program and others, and also to Black Earth Minerals for their in-kind support. In Somaliland, we've joint ventured with Diversity Action Group, and we've established 4 clubfoot clinics. We have a scholarship program that's focused in Somaliland. We have 18 specialty trainees studying in Ethiopia, 4 medical students studying in Hargeisa in Somaliland, and we have 2 orthopaedic fellows who are studying in India. In Ethiopia, the focus has always been on orthopaedics, and as I said, we've trained more than 100 orthopaedic surgeons. We train about 25 orthopaedic registrars annually and have quite a lot of nurse training, and we support 10 public hospitals with training, equipment and infrastructure. We ensure supplies of necessary orthopaedic implants for fractures and things of that nature. In 2022, we're, after a bit of a gap because of COVID, we're resuming our volunteer team travel into Ethiopia and Madagascar. We're also trying to do as much as we can to support Ethiopian hospitals in their hour of need. In my little pet project is in Madagascar, where I spend most of my time, is trying to get up a national endoscopy treatment and training centre. So thanks, and I think I'll take questions later.